Well, good afternoon, everyone, and thank you for coming. I want to thank, of course, my colleagues, Deputy Premier Minister Ellis, Minister Guthrie, Minister Turton for joining me, and of course, Parents Empowering Parents are terrific advocates in Alberta and supporters. We are big supporters of the work they do as they are of ours. I want to thank Debbie Bridge and Lorena Gregg for coming from PEPS this morning. And also we appreciate the media showing up as well. The addiction crisis in Alberta devastates communities and families, not just here, but across the entire nation as well. Day after day, we hear of Canadians losing loved ones to addiction. And it's particularly heartbreaking when we hear stories of youth who are in active addiction and don't get the care, the treatment, and the recovery that they need. Every single Albertan, especially the youth, deserve an opportunity at recovery. And I think particularly of tragic stories we've seen in recent national media, including Brianna and Kamala, who died in British Columbia from overdoses that were facilitated by programming at the national and provincial level, both 13 and 14 years old. This tragic end is the end that addiction is left with if we do not treat it, if we do not intervene as a society and provide alternatives to the tragic recourse that eventually comes if addiction runs to its natural end. The reality is that addiction is not a lifestyle choice. It is a tragic situation that is something that can be treated, that one can recover from. And as I said before, every single Albertan, especially our children, deserve an opportunity at recovery if they suffer from the deadly disease of addiction. And that is why we're continuing to move forward when it comes to Alberta's recovery model. We oppose the federal government's policy around unsafe supply, we oppose decriminalization, and we oppose dramatic and radical harm reduction policies when it comes to our youth in the province of Alberta. And that's why we're continuing to move forward with the Alberta Recovery Model, which is an opportunity for children to heal when they're suffering from the deadly disease of addiction. Significant work has already been done under the United Conservative Government, with Minister Ellis and others before me, increasing our bed capacity to over 10,000 new spaces available every single year. Of course, we've opened up 3 new recovery communities. Of the 11 that Alberta is building, 5 of those 11 are directly operated and owned by Indigenous communities that will have a continuum of care right from shelter space on the street to post-recovery housing and the treatment in between. We do not want to leave more Albertans left without an option to continue in their addiction. Instead, we want to provide alternatives to those who suffer from addiction, which is why we meet Albertans where they're at. No matter who they are, the Virtual Opioid Dependency Program is a pioneering policy that every jurisdiction looks at as best practice and gold standard when it comes to delivering evidence-based opioid medication for opioid agonist therapy. You can get same-day access, zero-cost treatment to evidence-proven medicine to help those who are suffering in opioid addiction and give them a life-saving breath of fresh air so that they can start on their path and journey towards recovery. We know especially that this is a difficult challenge when it comes to parents and children who suffer from addiction. And nothing is more heart-wringing than hearing the stories of those children who are suffering from addiction. Currently, Alberta has 70 addiction treatment beds across the province for youth when it comes to an addiction crisis. And I'm pleased to announce that work is currently underway to more than double this capacity with the establishment of the Northern Alberta Youth Recovery Centre, which is 105 new, above and beyond the 70 already existed, treatment beds for children under the age of 18 in the province of Alberta. This is a $23 million investment that will change the lives of up to 300 youth per year, along with the families, the parents, the siblings, and the communities that those youth belong to. It will be a renovation of an existing infrastructure asset that already exists, the Edmonton Young Offender Centre, turning half of that building into a recovery centre for healthcare and for healing for youth struggling with addiction. Significant renovations are in the process of taking place so that it can be a friendly environment for youth, to create a healing environment, one that brings people on the journey from addiction into long-term, life-giving recovery. We hope to be expecting clients in 2026 graduating from this Northern Alberta Youth Addiction Recovery Centre. Expanding capacity is going to be an important part of the Alberta model when it comes to spaces for youth who are in addiction. Of course, we see many families, tragically, that have to access legislation such as PCHAD, Protecting Children Abusing Drugs Act, which creates the framework to allow parents, legal guardians to request their children to be placed in mandatory detox and treatment for up to 15 days. Building this infrastructure is a big step forward in the Alberta recovery model, making sure that recovery is accessible to all Albertans, especially those youth in Northern Alberta. Just like all publicly funded addiction treatment, services will be provided in this centre for youth who are struggling with addiction care, accessible to all. The youth centre will be free for all Albertans. This announcement is a clear contrast to what's offered by radical activists who oppose the Alberta recovery model and oppose the idea of giving health care to those, especially our youth, who struggle with addiction, and instead continue to facilitate addiction for those who are underage. When it comes to our children, we have to do better. We must invest in the future, especially those vulnerable children, often who are subject to intergenerational trauma, whose addiction is passed down from one generation to the next. The intervention and the obligation we have as society is to build the capacity to care for those who are in addiction and make sure that we continue to meet the need wherever it is across our province. So I'm going to welcome up Minister Ellis and the Deputy Premier to give some remarks as well. Thank you.
Well, thank you very much, Minister Williams, of course, colleagues and guests that are here today. This is truly actually a very exciting day in the province of Alberta. The Alberta recovery model continues its success for youth and, of course, those young folks that are battling addiction. Youth facing addiction need to be reassured that recovery, of course, is achievable and that there is a path towards healing. And, of course, by providing these supports and resources, we're also providing something that's very most important. We're providing hope. We're providing a brighter future where we can empower these youth to seek the help that they need. This, in turn, will foster resilience and a renewed sense of purpose. The Northern Alberta Youth Recovery Centre is a beacon of hope, offering a safe and supportive environment for young people to overcome addiction and a new start. You know, in my time as the Associate Minister of Mental Health Addiction, I heard from parents all the time, what do I do? Where can I take my kids? And this is going to be an opportunity to provide that hope for parents who have children that are struggling with addictions issues. So for young people, addiction can be particularly impactful with their education, their relationships, their future. And it's, of course, our collective responsibility as a government to provide them with necessary support and resources to overcome that challenge. Addiction is often a cycle of recidivism, with individuals struggling to overcome their addiction only to relapse and start the cycle again. Our government will not give up on our kids. We will not give up on people and anyone struggling with addiction. There's always going to be hope, and that's why we have a world-renowned oriented system of care known as the Alberta Recovery Model. In conclusion, I just want to say thank you. I want to thank Premier Smith for her support and her advocacy in helping those who are struggling with addiction and mental health issues. Mr. Williams for continuing that fight as the Minister of Mental Health and Addictions, and of course all of my colleagues that are here today to support this, and the announcement of the Northern Alberta Youth Recovery Centre. Of course, I look forward to continuing to fight the fight and make sure that people who are struggling with addiction get the help that they need so that they can have hope for recovery. And with that, I welcome my friend, the Minister of Infrastructure, to the stage.
Well, good afternoon. It's a pleasure to join Ministers Williams, Turton, and Ellis, as well as Debbie Bridge of the Parents Empowering Parents Society here this afternoon. Through the 2024 capital plan, we allocated $105 million in funding over the next 3 years to develop recovery communities across the province, 3 of which are already open and accepting clients. In addition, we have another 8 more facilities currently underway at various stages of planning, design, and construction. We know that there are many young Albertans that require comprehensive long-term treatment. That is why our government is investing $23 million into the renovation and upgrade of a currently underutilized section of the Edmonton Young Offenders Centre to create the new Northern Alberta Youth Recovery Centre. This new facility will provide a dedicated recovery community with additional mental health and addiction services for youth up to the age of 18. Of course, the new centre will have its own separate entrance and will operate independently from the Corrections Centre. Our design will provide a welcoming and open environment to help youth and their families feel at home while in the facility. Once renovated, this centre will include modernized, upgraded spaces including 105 beds, an Indigenous ceremonial room, a new administration office, staff accommodation, and a visiting area, as well as mechanical and electrical upgrades. The renovations are expected to begin in the spring and be completed by the end of 2025, creating more than 140 jobs related to planning, design, and construction along the way. We anticipate the new centre will begin accepting clients by mid-2026. Providing treatment and support for young Albertans is vital in addressing the addictions crisis. Our department and our government is committed to delivering the essential infrastructure needed to ensure these services are available as quickly as possible. Thank you. Minister Turton.
Well, good afternoon, everyone. I'm honored to join Minister Williams, Minister Guthrie, and Minister Ellis today in support of the Northern Alberta Youth Recovery Centre. I just want to take a moment to highlight the fact that there are 4 ministers up here, and that just goes to show how dedicated our government is to working cross-ministry to make life better for youth who may be struggling. As Minister of Children and Family Services, I see the increase in young people and the issues that they face regarding mental health and addiction challenges. I hear about it from staff and stakeholders, how it adds stress to families, it impacts relationships, and potentially leads to involvement with the child intervention system. As a government, we are focused on prevention and early intervention to avoid the need for more intensive services. And one of the best ways we can prevent future mental health and addiction challenges is by helping youth pursue recovery and end cycles of addiction and abuse. I'm so pleased that the Northern Alberta Youth Recovery Centre in Edmonton will play a key role in that, giving families and caregivers comfort and peace of mind, knowing that their loved ones will be able to access the treatment they deserve in a home-like environment that will aid in their recovery. This expanded access to mental health and addiction services will build on existing community-based programs that support services specifically for youth. This includes our family resource networks that have connected thousands of children, youth, and families to a wide range of programs that strengthen social connections and self-worth, as well as connect with mental health resources and build resiliency so that families can successfully cope with and overcome any challenges that they may face. It will also build on the Youth Virtual Opioid Dependency Program, which includes same-day addiction treatment possible for those at our provincial campus-based care centres, and the Youth Suicide Prevention Grant Program, because we know that those facing mental health and addiction challenges are at an increased risk of suicide. Youth in Alberta need to have hope that a better, brighter, and more successful future is possible. No matter the circumstances that led to the challenges that they face, they are valued and worthy of a brighter future. The Northern Alberta Youth Recovery Centre will be among the first steps many young people take in their healing and recovery journeys. And I cannot be more proud of the collective efforts of my colleagues to help improve the health and well-being of so many Albertans. I look forward to the grand opening of this project and even more to the life-changing impact the Northern Alberta Youth Recovery Centre will have on many young Albertans. Thank you very much, and now I'd like to turn it over to Debbie Bridge from Parents Empowering Parents Society. Thank you.
Hello. I'd like to express my gratitude on behalf of PEP Society for having the opportunity to come and briefly share a little bit of my story. 6 years ago, my family went through an incredibly difficult time. Our daughter had started using substances, had dropped out of school, left home, and it left us devastated. It had a profound impact on our relationship and our lives as a family. It truly felt like everything had changed overnight, and we didn't know where to turn or how to begin even making sense of what was happening. And thankfully, we were able to access programs like PCHAD and PEP Society here in Alberta that offered the support we desperately needed. We had no idea where to turn for help for our teenage daughter. PCHAD provided us with a short period of respite and even some counseling. PEP Society gave us education, practical tools, and a community of support. Both programs helped us not only navigate what we were facing, but also begin healing as a family. So I'd like to thank the Alberta government for investing in programs like PCHAD and PEP Society for Families. These kinds of investments are truly supportive because addiction doesn't just impact individuals, doesn't just impact the youth, it impacts the entire family and community. So I'm grateful that this kind of support is growing. For families and youth in Alberta, it's an investment in stronger families and healthier communities. Thank you.
Thank you, everyone. We'll move to the Q&A portion of the announcement. We have a microphone over there in the corner. If you want to state your name and outlet, and we'll just start with one question, one follow-up.
Hi, Sean Amato with City News. So you're putting a recovery center in an offender center. Just looking at the renderings, it kind of looks like a correctional facility. What sort of thought was put to the stigma that may be attached to this, that young people are being punished when they enter a facility that looks like a correctional institute?
Appreciate the question. Look, this is not a correction facility. We made extensive renovation commitments here with $23 million to make sure this is a place of healing. I'm not a minister of justice. I'm not a minister responsible for enforcement of laws. I'm a minister of health. And it's key for me that this be a healing place. If you go across Canada, you see policies from provincial governments that don't have addiction policy that heals. Instead, they have addiction policy that facilitates addiction and leads to stories like I talked about with Kamala and with Brianna in British Columbia, dead at 12, or 13 and 14. This is the alternative. This is a hopeful, life-affirming path. And Albertans are clamoring for an opportunity to get addiction treatment spaces. So we found existing infrastructure that we could repurpose that is going to have extensive renovations, but we're going to be done years faster than would be otherwise, providing 300 spaces per annum for those who otherwise wouldn't have access. We're more than doubling our total provincial capacity. The imperative to get treatment out is so, it's a moral obligation we have in society to make sure that we're caring for those in addiction. We're doing it in a healing way, in a charitable and a compassionate way. And Albertans understand that we have a priority to do it quickly and to do it thoughtfully in terms of the dollars spent. I think this is a best case scenario for everyone to get those 300 treatment spaces out as soon as humanly possible.
What's the latest on involuntary treatment in Alberta, and will youth be sent there involuntarily for treatment?
So as you heard from the PEP's presentation earlier, PCHAD, Protection of Children Abusing Drugs Act, already exists in the province. And so this is a mandatory treatment regime that Alberta has, that parents of those, for example, that 13 and 14-year-old who died, they wish they had this capacity in British Columbia that we have here. So that already exists. And we have about a quarter of our beds that will be used for PCHAD at this facility. But it will also have a vast majority being voluntary treatment spaces. When it comes to the broader compassionate intervention legislation, we're working on that policy now. We're drafting legislation. We're going to be engaging with the wider community, and we're hoping to bring that forward to the legislature this spring, and we'll see what the legislature does with that vote. But it's an incredibly important policy that says if someone is a danger to themselves or others because of their addiction or because of their drug use, then we have an obligation to intervene as a society and care for them. We had one individual who overdosed, according to our numbers, 186 times last year in the province of Alberta. Every single one of those overdoses is cerebral hypoxia. That means that they are effectively drowning in daylight. That means that they are one breath away from death. And I do not want that 187th time for that individual to be death. And that's what compassionate intervention is going to be able to help us with. Those individuals that have had no recourse are overdosing multiple times in a week, if not in a day, and they've tried all other options. So for that very narrow set of people, we need to intervene.
Move next here in the queue.
Hi, I'm Miriam with CTV Edmonton. So my first question is, what is the current wait time for youth to get into the addiction treatment bed? And if you don't know that number, why choose the number 105 without really knowing how many beds are needed to solve the issue?
It depends on the different facility you're going into. So some individuals ordered into PCHAD can get access right away. If families have a particular treatment that they're looking for from a private provider, it could be different, but it depends on the facility. We have about a half dozen different facilities, a little more than that across the province, that currently have those 70 beds. And so we're looking on trying to reduce the total burden on that. And we chose one of 5 because that's as many beds as I could fund with the dollars I had, and I will continue to fund more beds and build more capacity as long as I'm in the ministry.
And my follow-up is, how will this facility factor into your plans for compensation intervention legislation coming next spring? And will this be the facility where youth will be mandated into treatment, or will you need additional spaces?
So similar to the last question, compassionate intervention is coming forward this spring. It's an important piece of legislation that allows us to care for those who are a danger to themselves or others because of their drug use. This legislation already exists for children under the age of 18. Under PCHAD, we're going to be updating that PCHAD regime with compassionate intervention. But as of the current state of the law right now, PCHAD already has the capacity to have mandatory treatment for up to 15 days. And this facility, along with all the others in the province, has some capacity for PCHAD. About 1/4 of the beds in this 105 are going to be dedicated towards PCHAD.
Thank you. And I do have a question for Minister Ellis, just for my colleague.
Yeah, happily.
Thank you. So this question is in regards to Trump's tariff threats on Canada. My colleague says, I know Minister Ellis has been in talks with authorities about securing the border. Where are those conversations at? What are you doing as a provincial official to secure the border? And what do you need from Ottawa?
Yeah, I mean, I've been saying this for well over a year, that we would be looking at placing more sheriffs along the border in the United States, along the border with the United States. We also indicated that we'd be placing additional sheriffs along our border with British Columbia as well. That's fine. They chose to go down a path of decriminalization, as Minister Williams had indicated. That is something that we do not support in Alberta, and we know that drugs are being diverted. Those so-called safe supply drugs are being diverted and potentially going into Alberta, if not through Alberta, and that's something that we're not going to, we're not going to tolerate. So, if anything here, this is kind of expedited the process. As you know, we're in the process of creating the independent police service. There's conversations that we had today. I know that the Premier and I likely will be reaching out to the Governor of Montana. We also have to include our good friends on the Blackfeet Reserve, which is in the Montana area, as well as our folks in the Blood Reserve as well. A lot of this is part of the Blackfoot Confederacy, so we want to make sure that we include them in these conversations. But also understand this, is it's a bit of a two-way street. So yes, due to the soft and crime policies of the federal government, just created an environment that has allowed organized crime to thrive with little or no consequences. And I'm going to make the assumption here that President-elect Trump has realized that, hence why Alberta, if not Canada, has become a net exporter of fentanyl. And so that is a deep concern. But we also have concerns about illegal guns, illegal drugs, human trafficking that is also coming across the border. So I think that we're going to take the perspective here in Alberta is working with the up-and-coming Trump administration, as well as working with the Montana government, because I think that we have similar goals. We want to make sure that we shore up the borders in the between Montana and Alberta. We want to stop any illegal flow of human trafficking, as well as drugs and guns that are coming across the border from the United States into Alberta. And we appreciate the fact that they want to stop any sort of illegal drugs that might be coming from Alberta into Montana. And so I'll be working with my colleagues in cabinet to reinforce our sheriffs. We will be looking at maybe reinforcing our investigation arm, which is our Alberta Law Enforcement Response Team, and seeing what tactics they can do. I know that they do have good relationships with the DEA, CIA, and of course the FBI. So we'll be getting briefed on kind of the outcome of those conversations. But, I would just say this in regards to, and the Premier said this as well, I mean, what President-elect Trump has indicated, he's not wrong. There are illegal drugs that are coming from Canada and Alberta into the United States, and he wants to keep Americans alive, and that's why we want to keep Canadians alive, and we want to keep Albertans alive, and that's why we're here today as a part of that multi-pronged approach. So there is the approach when it comes to law enforcement, but it's also what Minister Williams is doing here. We want to make sure those who have addictions issues, and I think, as we call it, the Alberta model, which has been internationally recognized, I think President-elect Trump, and I think anyone in the United States needs to learn about the Alberta model and understand that we have very similar goals.
Thank you.
Thank you. We'll move to the next question here in the room, and then we'll jump to the phones.
Hi, Cindy Tran with the Edmonton Journal. This is towards Minister Williams. So the Office of the Child and Youth Advocate, in their report, they'd said of the 48 youth cases they've reviewed, 26 struggle with mental health and addictions. I'm wondering if you have current statistics for youths who are struggling with addictions, and if you also had the number of youths accessing the virtual opioid dependency program.
I can try and get my office to get you the numbers on the virtual opioid dependency program for youth. We have now set up a dedicated space through the virtual opioid dependency program for youth. When it comes to those children who are tragically involved with addiction and mental health crises in that report you mentioned, it's important to note 88% of those who had overdoses due to drugs also had parents who were in active addiction. This is an intergenerational problem. The Alberta Recovery Model cares about every single aspect of addiction and how it affects the family unit. And so not only do we need to address these youth spaces that we're building today, those 105 that will be accessible to children in Minister Turton's care, the ones that report references, we also know that the 11 recovery communities we're building, 5 of which are with Indigenous communities owned and operated, we have 3 already up and running that have up to 1 year incredibly high quality best treatment available in Canada at zero cost to Albertans, that adult capacity is absolutely essential for breaking that cycle of addiction between generations as well.
So we spoke to experts in the past who said services and needs for youth who are struggling with addictions is different for adults. With this new facility, what kind of services will you offer that cater to youth specifically?
We're going to have best practice when it comes to recovery in youth. Of course, the disease of addiction is only one addiction, but of course, youth needs special services and wraparound support. So we're going to be engaging with Minister Turton's office to make sure that we have children and family services integrated closely with it. And of course, as we integrate youth out again, there's an entire social fabric we need to be connecting them to through education and the broader community. So I say all the time when it comes to Recovery Alberta and my Ministry of Mental Health and Addiction, I need to be as connected to the emergency room as I am the classroom. And that's especially true when we're talking about interventions that involve youth who are school age, is making sure that they can reconnect into the wider community.
Okay, we're going to jump to the phones here. Operator, can you put through our first caller?
Hello? First caller, you're on the air.
Okay. You might have...
Your first caller comes from the line of Darren Ratwell from 660 News Radio. Your line is now open.
Hello. Thank you for taking my call. The Child Advocate recommended in 2021 the province establish a dedicated body such as a committee or a commission to develop and implement a youth opioid and substance strategy, but that hasn't taken place yet. Do you have any plans for such a body, and if not, why not?
Well, we very much enjoy partnering with the advocate. There's a number of different recommendations she's made in the past, including increasing access to mental health care on reserve and for Indigenous communities, which she has in this last report has marked as a met goal. The province has accomplished that. We're going to continue to work with the advocate, whose recommendations largely focus around more access to recovery. It's very well timed that we have this announcement during National Addiction Awareness Week, and just following on the heels of the announcement of that report, where her plea was effectively, let's increase access to recovery. Let's make sure recovery is at the heart of how we care for youth. And so this 105 beds is a part of an answer to her entire report and the particulars that she's asking for.
Okay, and do you have a follow-up, Darren?
I do. You speak about the allowance for mandatory treatment within a portion of this facility. Is there a demand rising for mandatory treatment in Alberta among youth?
Tragically, there's a demand for addictive opioids and methamphetamine and other incredibly dangerous drugs, which translates to increased addiction, especially among youth. So we know we need to do more. I will say in my conversations with parents, with addiction treatment providers that focus on youth, one of the key factors they're considering is 15 days, well, 10 days extendable by 5 to a total of 15 days is too short, especially when you talk about the nature of addiction and the nature of the drugs that are currently in the market today. That barely gets you through a detox period. And if you want to seriously address addiction, for example, our adult treatment facilities allow up to 1 year stay at zero cost to Albertans who are struggling with addiction. That's the kind of serious social psychotherapy and work that needs to happen in a therapeutic living environment, in a community-based environment, to address the factors that go into driving someone into a state of devastating addiction. And so we're looking at what that means in terms of updating compassion intervention and updating PCHAD regime to make sure that it's caring for those who are struggling with addiction and making sure that parents are deeply involved, not in a combative way, but in a collaborative way in getting their children the care that they all deserve.
Okay, we got time for one more question, so we'll take a caller from the phone and then we'll wrap it up.
Your next caller comes from the line of Michelle Belfontaine from CBC. Your line is open.
Yeah, thanks for taking my questions. My first question is, who will run this facility? Will it be the government of Alberta, or will it be a third party? And if it is a third party, why a third party?
Thanks for the question, Michelle. We're not sure exactly who is going to run. We're going to go through a process to look at best suited. It won't be the government, but it may be Recovery Alberta, the newly established provincial health authority when it comes to mental health and addiction. They're particularly well positioned to run facilities like this. So they are probably the top contender right now. But we still have some time for the construction, and we're going to have a straightforward process if we decide not to go with Recovery Alberta. But that's my leading candidate.
And follow-up?
Yeah, as a follow-up, I just wanted to follow up on what Sean Amato asked earlier about the fact that you're putting this addiction center at the same place as the youth correction center. I know you're talking about you're going to have all these renovations to make it, much more friendly, but isn't the government, aren't you concerned about the optics of putting a recovery center right next to a corrections facility, like the same facility? I'm just wondering what kind of considerations, and why there? Why not another standalone building?
I'm concerned about not having 300 treatments a year for youth who need addiction treatment. I have a mandate letter that requires I care for those who are in addiction, and I need to do that as swiftly as I can. Delaying that for optics because somebody might have the wrong impression after $23 million is spent to very quickly renovate a facility, I think is misguided. And I think that every one of those parents of those 300 treatment spaces per year will tell every critic that we want to see this yesterday and as soon as possible. So it's not me you have to contend with. It's the parents who are begging and pleading for access to treatment. And Alberta is the only jurisdiction that has PCHAD with treatment. We're the only jurisdiction that has the level of access to virtual opioid dependency program. And we're going to be leading the country when it comes to addiction treatment spaces. The question is, should we delay 300 treatment spaces a year because we have critics on the outside, the media, or others that don't like the optics of getting world-class, best standard treatment for youth?
Perfect. Thanks, and that's all the time we have today.